My name is Dr. Kate Truitt, and I'd like to talk a little bit about the role of the fear brain, more specifically the amygdala, in coronavirus stress and anxiety. Now, we all have this part of our brain called the amygdala. Most of us recognize it from being connected to the fight, flight, or freeze state. And the amygdala, whom I lovingly call Amy, is in effect a honing beacon for threats in our environment. She's always looking out for us, wanting to make sure we're safe. And when she identifies a threat, she's going to take several courses of action. One might be an innate action that we're born into this world with, such as if we're walking down a street and we see a hose, we might stutter step thinking it's a snake, because Amy is going to say snakes are bad because over the evolution of our species, we've learned that. Or it might be a learned response. And I'd like to specifically talk about the learned responses right now because our brains are firing and wiring in some pretty crazy ways right now around what historically would have been foreseen as a possible allergy or a light head cold, or given a consult I just did this morning, maybe a little too much wine last night and somebody has a headache. So our brains are tapping into, and specifically Amy's tapping into, all fear stimuli as something that's scary and overwhelming. And one of the things that Amy does is she loves to tell stories and spin worst case scenarios. She's the proselytizer at the end of the world anytime she starts to notice a threat. And so we can get stuck in these ruminating thoughts about what's real and not real. And her version of truth is always going to be, we're all going to die. Her only job is to keep us alive. She really does not care about quality of life. So I'd like to provide a couple tips if you notice yourself ruminating or hyper-focusing on a physical symptom. Now, this of course does not mean that if you're struggling to breathe or having severe symptoms that you don't go to the urgent care, the ER. Of course, get appropriate medical care. But one of the things that happens is Amy can start to manifest physiological experiences that feel just as real as the symptoms we would be having. And a wonderful example of this is a panic attack. It feels very much like a heart attack if you're having a panic attack. People often go to the ER, and it turns out it's the amygdala driving this host of physiological symptoms that results in the experience of feeling like we're going to die. So if you start to notice that you're down the rabbit hole of ruminating thoughts, you're hyper-focusing on a physical sensation, you're hyper-focusing on worst-case scenario stories. If you've watched Contagion, don't watch that right now, not a good idea. These are some tips you can do immediately. First and foremost is self-havening. Self-havening actually is a intervention that interacts directly with the amygdala. It's one of the only interventions that I know of, and I've been working in this field for a very long time, that creates the correct electrochemical landscape to pull the brain out of the fear spiral and move it very, very quickly into a state of grounded calm. The self-havening touches are across the face and the cheeks, and make sure you've washed your hands before applying the touch here. Down the arms, just like you're giving yourself a nice hug. And I like to imagine when I'm doing self-havening that I'm hugging Amy. I'm going, I love you, it's okay, we're fine. And then palm havening. So anytime you wash your hands, sing a song, you're giving Amy a little bit of love every single time you wash your hands. The second part of self-havening to help Amy calm down is to sing a song, like I just said, or play a category game. A to Z, bands, A to Z, places in the world. You can imagine you're walking up a series of steps. I have my little puppy dog here with me right now, and I like to imagine I'm giving her tummy rubs and throwing the ball for her while I self-haven, because that makes me smile. This is Tinkerbell, by the way. Say hi, Tinkerbell. Hi. So basically any positive or neutral distraction, and then you want to continue to apply the self-havening touch for 7 to 10 minutes. Another wonderful technique is cognitive behavioral therapy. It's a renowned therapeutic intervention for challenging, difficult thoughts. If you find that you're really struggling with being in that ruminating rabbit hole and the havening has definitely taken the edge off, but your brain clicks into it again, start writing down questions about the thoughts that you're having. And I'm going to link a thought challenging worksheet that we have on our website below this video for you that one of my associates put together that is really a beautiful series of questions of, will this thought hold up in a court? Does it hold water? Is this thought completely true? Are there other possible options of what might be happening? And other thought challenges that can get your thinking brain back online and running the show, letting Amy know that she doesn't need to be in charge anymore. Additionally, breath work, meditation, yoga, those are all ways to calm the system. Those are autonomic nervous system regulators. If you don't have Heartmath, this is a wonderful opportunity to invest in the Heartmath Bluetooth equipment. It's a one-time charge. I think it's $179. The app is free, and you get a whole slew of amazing guided meditations and exercises, and it's based in biofeedback, which means that you're actually getting real-time information about your body and your stress while you're doing the exercises. It's wonderful. We actually offer it to our patients in our clinic, and it's just a phenomenal opportunity to be in a stronger, healthier relationship with your brain and your body. So stay tuned. We'll have many guided meditations coming up that we'll be releasing. All my team members are working on them. Our goal right now is to be in service of you and the community. We have a Friday community corner that will be happening, and so stay tuned for that. And let us know how we can help you. Let us know what resources you're looking for. If you want more guided meditations of a certain type, tell me in the comments. Our goal, as I said, is to be here for you. And of course, if you'd like some additional support, my teams are extremely well trained in navigating the fear-based brain. They've all been mentored and trained by me for many years, and they're experts in helping the amygdala calm down and feel better. So give us a call.